What detective work is needed to diagnose raw vasculitis? Imagine trying to solve a complex puzzle where the pieces look similar but belong to different pictures. Diagnosing rheumatoid arthritis vasculitis is just like that. It requires a careful, step-by-step approach combining many clues to find the full picture. First, doctors start with a detailed medical history and physical exam. They look for signs like new skin rashes, ulcers, numbness or weakness in the limbs, which suggest nerve involvement. They also check for symptoms like fever, weight loss, or digital gangrene, which can point to blood vessel inflammation. If a person has long-standing, severe rheumatoid arthritis with joint deformities and high rheumatoid factor levels, that raises suspicion even more. Next, laboratory tests are used to look for signs of inflammation and immune activity. Blood tests often show elevated markers like erythrocyte sedimentation rate and C-reactive protein, which tell us that inflammation is active. Very high rheumatoid factor levels can also be a clue. Sometimes, tests reveal low complement levels or unusual autoantibodies. These findings support the idea that systemic inflammation is happening but don't confirm vasculitis by themselves. They are pieces of the puzzle, not the whole picture. Specialized tests can help further. For example, nerve conduction studies are useful if nerve damage or peripheral neuropathy is suspected. These tests help identify nerve involvement and guide where to take tissue samples for biopsy. Imaging studies such as X-rays, computed tomography scans, magnetic resonance imaging, or angiography can reveal blood vessel abnormalities or organ involvement. However, these images often show nonspecific changes, so they are part of the overall assessment rather than definitive proof. The most conclusive step is a tissue biopsy. This involves taking a small sample from affected skin, nerve, muscle, or other organs. Under the microscope, pathologists look for characteristic signs of vasculitis, like inflammation and destruction of small or medium blood vessel walls. But interpreting biopsy results requires care, as other diseases like atherosclerosis or diabetes can also damage blood vessels. It's important to differentiate raw vasculitis from other vasculitides or vascular conditions. Of course, doctors also need to rule out other causes of similar symptoms. Infections, other types of vasculitis such as polyarteritis nodosa, or vascular diseases must be considered and excluded through testing. This thorough detective work, combining clinical evaluation, blood tests, nerve studies, imaging, and biopsy, helps ensure an accurate diagnosis. It's a careful process that guides appropriate treatment and management, which is especially important because raw vasculitis is a serious but rare complication. Always remember, each person's situation is unique, so consulting a healthcare professional is essential for personalized care.